Hi everyone, and in this video I'll be discussing pharmacotherapy of gout. That means the drugs used in the management of gout. What is the reason for gout? We all know that the gout is because of increase in uric acid. When the uric acid is increased, it gets deposited in the joint, and the patient comes with joint pain. Usually, the first metatarsophalangeal joint is the one which gets involved, and that is what we call it as acute attack of gout. So, in managing gout, there are two things to take care. One is to manage the attack, and second one is to give prophylaxis. So let us understand the pharmacotherapy of gout, how the drugs work, and what is the pathophysiology first. Now, to understand pathophysiology, I just want to tell you what is the source for uric acid. Remember, the uric acid source is from purine. So the purine metabolism will give rise to xanthin. From xanthin, we get the uric acid. So the enzyme which is involved in the metabolism of xanthin is called xanthin oxidase. The enzyme name is xanthin oxidase. So the metabolism of purine will give us a xanthin, and from that we get uric acid. Now what happens with this uric acid? This uric acid gets deposited in the joint. So uric acid gets deposited in joint. So when the uric acid gets deposited in the joint, so there is a start of inflammation. So there is inflammation of the joint. So the inflammation starts. Now once the inflammation starts, to the site of inflammation, who migrates is neutrophil. So there is neutrophil chemotaxis. There is neutrophil chemotaxis. Now once the neutrophil chemotaxis occurs, inflammation starts, the patient will complain of pain. And that pain is what we call it as acute gout. So that pain is what we call it as acute gout. So the point where the acute gout is triggered is below this. So whenever the uric acid is high, it gets deposited in the joint, inflammation, neutrophil chemotaxis, and pain, that is called acute gout. So any drug which we use below this line are the drugs. Okay, I'll repeat again. Any drugs used below this line are the drugs used for acute gout. So let me tell you what are the drugs used for acute gout. Whenever there is pain, obviously what we use is NSAIDs. So non-steroidal anti-inflammatory drugs. Now NSAIDs, the commonly used NSAIDs are diclofenac, then indomethacin. So these drugs are commonly used NSAIDs to take care of the pain. But can you guess which NSAID is absolutely contraindicated in acute gout? The contraindicated NSAID. What is contraindicated in acute gout is aspirin. Aspirin being an NSAID, it is contraindicated because aspirin itself can increase uric acid level. That's the reason the NSAID that is contraindicated in acute gout is aspirin. So that is number one that is used in acute gout. Number two, the drug which inhibits neutrophil chemotaxis. So what is the drug name which inhibits neutrophil chemotaxis? The name is called colchicine. The name is colchicine, and it is obtained from a plant. Now colchicine mechanism of action is it inhibits microtubule. So it inhibits microtubules. So thereby it inhibits mitotic process, mitosis. Not only that, also inhibits neutrophil chemotaxis. What is the adverse effect of this drug, colchicine? The adverse effect of the drug is diarrhea. Now why the drug causes diarrhea? Because it inhibits mitosis in the intestinal epithelium. So if the intestinal epithelium don't regenerate, so there is a chance of diarrhea. So that's the reason the drug colchicine can cause diarrhea. It inhibits microtubules, and recently they had asked which drug inhibits neutrophil chemotaxis. The name is colchicine. That is target number, that is C. So the next one is target number C, the one which decrease inflammation. What are those? They are called steroids. So steroids, what we use during acute gout, usually steroids are not required, but when we are using steroid, they are usually given into the joint. They are called intra-articular steroids. So steroids can be given intra-articular. Please understand three major therapies for acute gout. Number one, NSAID. Number two, colchicine. Number three, steroids, and they are given intra-articular. So these are the only three drugs what we use for acute gout. Now, any drug which acts above this point, they are used for chronic gout. So, any drug which acts above this point, they are used for chronic gout. So, point number one, what are the drugs used for chronic gout is the inhibition of xanthine oxidase. So, number one, the drugs which inhibit xanthine oxidase. Number two, the drugs which eliminate uric acid in the urine. So, these are called uricosuric drugs. So uricosuric drugs, they eliminate the uric acid in the urine. Now, in the birds, uric acid is converted into allantoin. And allantoin is water soluble, and this is done by the enzyme called uricase. So third important aspect is to convert uric acid into uricase. So in chronic gout, we have three strategies. In management of chronic gout, we have basically three strategies. Let me repeat. Number one, inhibit xanthine oxidase. Number two, give uricosuric drugs. And number three, use a recombinant uricase enzyme, that is, which will convert uric acid into allantoin. So this is what we can do. Now, once we are done with that, we know the drugs used in acute gout. Let me tell you what are the drugs used for chronic gout. So in that, number one, we have a drug group, and they are called xanthine oxidase inhibitors. So the drugs are called xanthine oxidase inhibitor. I'll write the mechanism again. So purine will give rise to hypoxanthine. Okay. So when I wrote pathophysiology, I didn't write hypoxanthine, so that I will explain in detail here. So you get xanthine, and xanthine will give rise to uric acid. So the enzyme which will do this job of converting is xanthine oxidase. So these enzymes are inhibited by two drugs. One is a non-purine. So the non-purine drug is called febuxostat. The name is called febuxostat, and a drug which is derived from purine. The name itself has purine in the name. Allo, you read the name, allo, purine, purinol. So it's a purine derivative. So the purine derivative is allopurinol, non-purine is febuxostat. You read the name of febuxostat. XO stands for xanthine oxidase. Usually the drugs which end with stat, they inhibit the enzyme. So what enzyme does it inhibit? Xanthine oxidase. So this is the mechanism of action of xanthine oxidase inhibitor. I will take up first allopurinol in this. So allopurinol. So allopurinol, after metabolism, will give rise to oxypurinol. So oxypurinol can also inhibit the enzyme xanthine oxidase. So it can also inhibit the enzyme xanthine oxidase. Now oxypurinol is not commonly available. So it has an orphan status. So it is not available. So the drug has orphan status. Then where do you use it? This oxypurinol is preferred in patient allergic to allopurinol. So if the patient is allergic to allopurinol, then we can give oxypurinol, and it's not so commonly available. The mechanism is same. It inhibits the enzyme xanthine oxidase. Now coming on to the uses of allopurinol. Uses of allopurinol. So let me write here uses of allopurinol. Now the uses of allopurinol is, number one, obviously it is used in chronic gout. So it is used in chronic gout. Now one more condition where the uric acid goes up in the body is when you kill so many cells. Where do you kill so many cells? In leukemia, lymphoma, So during anti-cancer therapy, the tumor cells are killed, the purine is released, purine will give rise to uric acid. So we call it as tumor lysis syndrome. So tumor lysis syndrome is a condition where the uric acid levels are high. So hyperuricemia is seen there. So this is the condition where we use allopurinol. So one is chronic gout, tumor lysis syndrome. Now other rare use of the drug is it is used in Lesch-Nyhan syndrome. So it is used in Lesch-Nyhan syndrome. It's a rare use, and also it is used in a disease called Chagas disease. So these are the other uses of allopurinol, but please keep in your mind it is mainly used for chronic gout as well as wherever the uric acid is high, that is tumor lysis syndrome, or any other causes for hyperuricemia like secondary hyperuricemia conditions. Also we use allopurinol. Any reason the uric acid is high, we use allopurinol. So one drawback of allopurinol was it was causing allergy. Now please understand, allopurinol, very important point, allopurinol, it is contraindicated in acute gout. It is contraindicated in acute gout. Not only this, even the drug febuxostat is contraindicated in acute gout. That's the reason why we should not use it. Now when you use these drugs, what happens? Suppose this is the circulation, the blood vessel. This is the blood vessel. And what happens when you use allopurinol? When you use allopurinol decreases uric acid in the circulation by inhibiting xanthine oxidase. Now the tissues will be storing the uric acid. So uric acid will be stored in the tissue. That's what is chronic gout. Now when we use it in acute gout, the uric acid is high. And what happens when you use allopurinol? Uric acid decreases. Now when the uric acid decreases, the tissue stores will release the uric acid again into the circulation. So suddenly the uric acid increases and there is a chance of acute gout getting precipitated. So that's the reason this allopurinol or febuxostat should not be used in acute gout. And also when you start a treatment with allopurinol, there is a chance that acute gout may get precipitated. Suppose a patient has chronic gout and you start allopurinol, suddenly the gout can get precipitated. The reason is simple. The reason is that the tissue stores of uric acid can come to circulation. Suddenly they increase and there is chance of acute gout episode. So how to avoid that? How to avoid this problem? To avoid this problem, there is one trick, that is whenever you are starting either allopurinol or you are starting febuxostat. So what you should do is you have to combine with NSAIDs or colchicine. So these are given for 3 months and these are given for 3 months. So then it is continued and you can stop this. So even if the acute gout precipitated, the NSAIDs and colchicine will take care of that. As a patient will not get acute gout precipitated. This is a clinical application. So when you start allopurinol or febuxostat, there is a chance acute gout may precipitate. The reason is the tissue store can mobilize into the blood vessel, uric acid increases. So this is the strategy what we follow. So once we are done with allopurinol, please understand a drug interaction with allopurinol. Now there is a drug called 6-mercaptopurine. So 6-mercaptopurine is an anti-cancer drug used to treat leukemias. Now we combine with allopurinol. Why do we combine with allopurinol? To avoid and treat tumor lysis syndrome. Now 6-mercaptopurine is metabolized by xanthine oxidase and it is made inactive. So 6-mercaptopurine is an anti-cancer drug and it is metabolized by xanthine oxidase and made inactive. That is a normal thing. Now question is, when we combine 6-mercaptopurine and allopurinol together, what happens? Allopurinol inhibits xanthine oxidase. Now the question is, when we combine these drugs, what is the dose of 6-mercaptopurine? Should we keep it normal, should I increase the dose or decrease the dose? So when I combine allopurinol plus 6 mercaptopurine, should I keep the dose of 6 mercaptopurine normal, increase it or decrease it? Just pause the video and answer. Yes, you are right. So what we are going to do is we have to decrease the dose of 6 mercaptopurine. Now you may ask a question, what if I use a normal dose? When I use a normal dose, what happens? Allopurinol inhibits the enzyme and 6 mercaptopurine level increases, leading to toxicity. Even if you increase the dose, the same problem. So better to avoid the toxicity, when we combine the drug, decrease the dose of 6 mercaptopurine. Very, very important drug interaction, repeatedly asked in your exams. Once I am done with the drug purine analog, that is allopurinol, so we have a drug called febuxostat. We have a drug called febuxostat. So it is also used for chronic gout, and it is used when the uric acid levels are high, that is hyperuricemia condition. The name is febuxostat. So first we have finished in chronic gout, that is xanthine oxidase inhibitor, allopurinol and febuxostat. So allopurinol can cause allergy, febuxostat will not cause it. The next class of drugs in chronic gout, they are called as uricosuric drugs. So uricosuric drugs, the name itself is telling you these drugs will eliminate the uric acid in the urine. So uric acid will be thrown out in the urine. How do we do that? Now to understand that, let me draw the nephron. So this is the nephron. Yes. And nearby the blood vessel. Nearby there is a blood vessel. Now uric acid is endogenous substance. So what happens whenever the uric acid is filtered, the uric acid is reabsorbed back. So the process is called reabsorption of uric acid. Now for that reabsorption, we have a transporter called URAT. So URAT stands for uric acid transporter, and that is going to reabsorb it back. Now we don't want uric acid, so we inhibit this URAT. So uricosuric drugs, basically they inhibit the reabsorption by inhibiting the uric acid transport. So this is the mechanism of action. But the problem is when you don't reabsorb, you are going to throw uric acid in the urine. So these uricosuric drugs can increase the risk of stones. So uric acid stones risk is increased. So the risk of uric acid stone is increased when you use uric acid drug. So how do we manage this? Patient should take adequate hydration. So hydration should be very good so that uric acid will not get precipitated. So the risk of uric acid stones are high with these uricosuric drugs. Now what are the drugs in this category? Uricosuric drugs. Yes, the name is called probenecid. It is called probenecid. Then we have a drug by the name sulfenpyrazole. So the name is called sulfenpyrazole, and similar to that, benzbromone. So these are the uricosuric drugs. Another important recently approved drug is called lesinurad. So these are the uricosuric drugs. Can you take a guess? An ARB, angiotensin. Okay, so angiotensin receptor blocker, which is having uricosuric property, it starts with low. The name is called losartan. You read the name, losartan lowers uric acid. So it is a uricosuric agent. So probenecid, sulfenpyrazole, benzbromone, lesinurad and losartan, these are the uricosuric drugs. The main complication is uric acid will come in the urine. There is a chance of uric acid stone. So you have to give adequate hydration. The story of this aspirin is beautiful. How come it causes hyperuricemia? Now let me write nephron. Before I write a nephron, I will explain to you. If I use more than 5 grams per day of aspirin, it decreases uric acid levels. So very good. If I use it at the dose of 2 to 5 gram per day, it has shown no effect on uric acid level. No effect on uric acid level. Very good. If I use it less than 2 gram per day, so then it increases uric acid in the circulation. So whatever aspirin we use, it is usually this is a therapeutic dose. So whenever you use aspirin, there is a chance of uric acid being high, and that's why aspirin is contraindicated in acute gout. 2 to 5 is very high dose, and more than 5 we don't want to use it because higher dose of aspirin causes gastritis, toxicity is more. Now what is the reason why it does like this? I will explain that. Now let me draw our nephron. This is the nephron. Yes. And this is the peritubular vessels. Now uric acid is endogenous substance. So uric acid can be done two ways. Uric acid can be reabsorbed back, and I told you the transporter is called urat. Now the same uric acid, it can also be secreted back. So the process is called secretion. You correlate with general pharma. So uric acid can also be secreted back. Now the uricosuric drugs inhibit this, we understand that. So if you are using aspirin for more than 5 gram per day, then the aspirin inhibits the urat, and that's why it decreases uric acid. That is very high dose. But when we use it less than 2 gram per day, then what does it do? It inhibits the secretion of uric acid. What happens if you inhibit the secretion of uric acid? The uric acid is not going out, so uric acid level increases. So this is what happens. Can you tell me one more drugs which can increase uric acid level? Yes, you are right. They are called diuretics. Now whenever we discuss diuretics, there are two diuretics, the loop diuretics and thiazide diuretics. They are known to cause hyperuricemia. How? They also inhibit the uric acid secretion and they can cause hyperuricemia. So aspirin, if you are using for less than 2 gram per day, it decreases the secretion of uric acid and lead to hyperuricemia. Same thing with diuretics, loop and thiazide. And 2 to 5 gram, it doesn't have any effect. So that is about the uricosuric drugs. Moving on to the third important concept is the enzyme. So uric acid is a bit lipid soluble, so it can get reabsorbed back. So in the birds, it is converted into allantoin, and the allantoin is water soluble, and you know from general pharma, water soluble, you can throw it easily in the kidney. So it is easily excreted in the kidney. But the enzyme which is required to do this is called uricase. And humans lack this enzyme. They don't have this enzyme. They don't have it. So if you don't have it, make the enzyme. So we have a recombinant technology to make the enzyme, and the name is called rasburicase. So the name itself has uricase. And remember, in pharma, the drugs which end with ASC are usually enzymes. And this is used for tumor lysis syndrome. So this is used for tumor lysis syndrome. And we have one more drug, and that is called pegloticase. So pegloticase is also an enzyme. It is used for chronic refractory gout. Chronic refractory gout. Now what do you mean by chronic refractory gout? We use the normal therapy for chronic gout, allopurinol, febuxostat, uricosuric agent. Still the gout is not getting controlled, then we use pegloticase. So it's a reserve drug. You cannot administer it repeatedly because it's our enzymes and they can develop antibodies and they may not work if you use it repeatedly. You may ask a question, sir, pegloticase, can I use it in tumor lysis syndrome? No, it is approved only for chronic gout. Can I use rasburicase in chronic gout? No, it is only approved for tumor lysis syndrome. So these are the drugs what we use in the management of gout. So basically remember, pathophysiology of gout is important. What are the drugs used for acute gout? NSAID. The NSAID contraindicated is aspirin. Second, we use steroids intra-articular. The drug which inhibits neutrophil chemotaxis is colchicine. Then the chronic gout, we use uricosuric agents, xanthine oxidase inhibitor, allopurinol and febuxostat. Then the recombinant enzyme uricase, rasbericase and peroxidase. So these are the drugs what we use in the management of gout. Thank you all.